Talk Live with Liz, sponsored by TriHealth.
Welcome back, everybody, and Health Talk Live today. The number of heart events on the rise in this year post-pandemic or in the aftermath of a pandemic year, very high. And tomorrow there will be a groundbreaking of a new heart center for care in our area. So joining us now to tell us what it will bring to our community, we want to welcome Mark Whitty. He's the TriHealth Vice President of Clinical Service Lines. And I know you got a big push recently with a big donation for this, did you not?
We did, Liz. Thank you. The Thomas family donated $10 million to this cause. And so it's really helping us kickstart a large project of over $80 million at Bethesda North Hospital.
So we have a little drone video of sort of your area where the Thomas Center is now, where you have the Cancer Center housed. Can you tell us exactly, like physically on your campus, where will this be? How easy will it be for patients to access?
So as your camera pans across the screen there, you'll see a new entrance at the front of the hospital that will be designated as the TriHealth Heart Hospital. And that's where patients will enter who are receiving both outpatient treatments and surgery and all of that. So it'll connect both outpatient services and inpatient services.
Excellent. And I know that you sent us some photos that gave us sort of a look inside. So we want to, of course, thank your team for that. But also, can you tell us sort of what makes this unique? What's a little different about it?
Well, what's unique about it is, first of all, the expansion of our capabilities here with our cath lab operations, specials lab, hybrid, also our CVI, our cardiovascular intensive care unit. So all of that now becomes integrated into one center. And that's really the biggest change, that patients will access all of that care through one entryway and have access to all of those services. So not only will we have new state-of-the-art facility and state-of-the-art equipment, it will be easier for patients and families to access that at the hospital.
I just have a quick graphic of a couple of things that you said are going to make this unique. I know you mentioned heart services and surgery sort of all in one place, the greater number of cardiac intensive care beds, but then you mentioned this hybrid operating room. Can you tell me a little bit about what that is?
So the hybrid room allows different specialists to work together with patients. So there are times where you have procedures that require the work of different specialists at the same time. And this room has the flexibility and space to allow all of that to happen. Very unique room that has to be set up and adaptable, whatever the needs the patient may have and the procedures that take place in that. But really, it's this emphasis about team-based care, how you can create teams even in a surgical setting, not only in the outpatient setting.
And I know you'll have a heart failure center there, something this community has not had yet. Mark Whitty, thank you so much for just what you're doing to bring better cardiac care. Certainly an important time for that.
Thanks for your time, Liz.
And we'd love to know what you're talking about, the coronavirus, your heart care, anything health related. Shoot me an email, hit me up on Facebook or Twitter. We'll be out to see some of that groundbreaking tomorrow. It's at Albonus1.